Good evening and Happy New Year. We are in 2026 and in keeping in alignment with our progression in your journey in successfully becoming a certified addiction counselor. Double Doc supporting you in the next part of this series. Now, one of the areas that was heavily saturated in the exam was the covering of many questions about the understanding of substance use and abuse and the aspect of remission and what that actually meant from a timeline perspective. So, what we're going to focus on today is how that determination is made. And there were a series of questions to make certain that I was clear on being able to distinguish what the symptoms that were associated with that and how to distinguish what the identifiers were. All right, so we're going to cover that and then we're going to essentially recap so we are all working from the same paradigm. Okay, so the actual, remember in the first video that we explored that doctrine that you need to make sure that you are utilizing the Diagnostic and Statistical Manual of Mental Health Disorders, the DSM-5 TR, is what is used as the standard piece of information that we go to be able to gather information about symptomology, right? And that is where you will find that criterion that is used to make the clinical gathering of information leading to diagnosis. Now, remember, based on where you are in the scope of what you do, you may not be a diagnostician or such as myself as a psychologist, but you can use it as a point of reference to see what those features actually are, right? So the DSM-5 includes that there are 11 symptoms across 4 categories, and those categories are impaired control, social problems, risky use, and the pharmacological aspect, right? And there's a severity associated within those 4 areas, okay? All right, so essentially, what you're going to be able to have to be able to understand is using more of the substance itself for a longer period than actually was intended, right? There's also the notion of a persistent desire or unsuccessful attempts to cut down, essentially to control the use. Now, remember, we talked about that with the cage, right? That first question, the C. Have you ever thought about cutting down? We're always going to do that to try to connect things so you can begin to remember as you proceed in this journey. Now, spending a lot of your time trying to obtain the specific substance, using and or recovering from the use of that substance. All right. And then the cravings, and we'll cover that, the notion of cravings and what that actually means in another video. Now, social problems, that's the second area. Failing to meet obligations. Very, very telling. And those obligations can be work, school, family, due to the use of the substance itself. Continued use despite the problems that it brings, the interpersonal problems that one would occur, giving up important responsibilities and activities, And then the impact to occupational endeavors because of the use. Now, the risky behaviors, most people tend to be able to hone in on this, right? The physical aspects that it brings to the self-harm. And that's what just being involved with using the substance, right? Now, the pharmacological element. So we're going to talk about this notion of tolerance in another video, but tolerance basically is using this substance at a certain capacity and then needing more of the substance to acquire the same effect, right? So gradually increasing the use over time. Okay. All right. And then experiencing the symptoms of withdrawal, experiencing those, and then using the substance to avoid experiencing the symptoms of withdrawal. Now, the severity is mild, moderate, and or severe. Now, for mild, there's 2 to 3 of those criterion must be met in order to place that mild modifier. Moderate is 4 to 5, and severe is 6 or more. Okay, so contingent upon those numbers of symptoms that are aligned, that is how the modifier would then be identified. Now, on the exam, there are scenarios that will be offered, and then you have to then state or select, if someone would meet the criterion based upon the modifier, and then if they would be at what point of remission, right? Now, an example would be if someone is in a certain level of care, and we'll talk about that later as well, but because they're in that particular level of care, let's say a residential placement, right? They don't have access to a controlled substance, right? So they could be in remission due to a contained environment, right? But remission in of itself is time contingent. Okay, so 3 months is early remission. 12 months is full sustained remission. So it's really contingent upon the number of months of not using access to the specific substance. And these scenarios will give you that information. Okay, so you have to pay attention to what's offered in the scenario and then make a determination based upon the time, the setting, and then select the multiple choice answer that best aligns with that information. Okay, so what we're kind of focusing on today is getting you to recognize that there are specific criterion as outlined in the DSM-5 that actually indicates the 4 areas of the impact of using the specific substance, right, that meets the criterion clinically. And then based on that, you will then make a determination whether or not that person would then be diagnosed, because they do ask you that. Would this person be diagnosed with substance use disorder in remission, full sustained remission? So you have to put all of that information together and look at those answers. Okay, so we essentially talked about the severity, the pharmacological impact, the risky use, and the actual criterion of the social problems, impaired control, and based on all of that information, that will then lead you to understand what substance use is. Thank you very much. Again, double doc, success, first time out to leading to certified addiction counselor. Good luck.